Greetings. For this assignment, it's in two sections. So it says, let's explain the role that nurses play in leadership and uses innovative approaches to advocate for disease prevention to ensure optimal patient outcome. Nurses do play a very crucial and critical role in leadership in healthcare, especially as we are always the forefront of patient care, we are the forefront of patient education, and we are also seen as advocates for the patient. Nurses do not only provide direct care, but we also help to shape and broaden the healthcare system in various scope. And I will touch on various ways that as nurses we can impact. The role of a nurse in leadership and disease prevention with optimal outcome. As nurses, we are health educators and counselors. We are often the first point of contact by patients. We educate the families, the individuals, the community about their lifestyle, about the choices they make, about vaccinations availability, about screenings to prevent further diseases, and we educate them about self-care practices like lifestyle modifications, especially for those with diabetes. And our goal is to reduce the risk of disease. We also help people to understand the impact of preventing future diseases. As a nurse, our brain should be focused on primary prevention. No new outcomes, secondary prevention, tertiary. Do not let anything that are already existing go out of hands. Secondly, we are advocates for preventive programs. As nurses, we do advocate for policy changes at various levels, at the local level, at the regional level, and even sometimes at the national level. And we prioritize everything based on disease prevention model. And we need inclusion in preventive care, especially when we're dealing with insurance companies, promoting wellness in communities, and encouraging the allocations of resources to be better managed by everyone who's out there. I'll take us now to the angle of informatics. As nurses, we do utilize a lot of technology to enhance patient education and monitor healthcare. We use telehealth to promote. We use so many apps on our phones right now to track healthcare symptoms, manage chronic conditions, and we've also incorporated these tools into preventive care, and it helps us in early detections and prevent future diseases. In my area, we do a lot of collaboration of what we call multidisciplinary team approach, where nurses alongside physicians, social workers, case managers, and every other facet in the facility, we work together to design and implement disease prevention strategies. And sometimes, or not sometimes, most often, we act as a liaison between the patients, the healthcare providers, their family members, to ensure that they do have adequate placement. And in addition, as nurses, we use data from the patient record and public health surveillance to identify trends in diseases, risk in diseases, and we design interventions to target and to prevent the outbreak of those diseases, quote unquote, tertiary prevention. And this method is always effective when we're trying to prevent more cases or comorbidities from the same illnesses. And the roles of the nurse in policy development is also not too different. We are in a unique position as nurses to influence healthcare policy due to our first-hand experience with patients and our understanding of the system. We can engage with local policymakers to advocate for community health programs, such as school health education and other programs that can use to target vulnerable populations. Because again, like the elderly, the LGBTQ, those in prisons, those in low socioeconomic status, we are the first-hand people, and society trusts and builds hope and confidence in us. We can also work with other local healthcare authorities to identify the gaps and suggest initiatives that we can improve access to things like immunization and mental health resources in order to reduce and minimize the gap that is out there in mental health. As nurses, we can play a role in influencing regional regulations that affect healthcare delivery and the workforce, such as ensuring proper staff patient ratio, which is going to be beneficial for both the patients and the staff due to safety and other sources, which is also going to help proper resources and proper training for healthcare workers. Nurses can advocate at various levels. We can advocate for those with chronic conditions, ensuring equal access and treatment options for underserved populations, such as those in the low socioeconomic status, the elderly, those in prison, and the LGBT community. There are some principles that, as nurses, we really need to understand, like promoting equity, practicing beneficence, non-maleficence, justice, and promoting the voice of the patients in policy development. So, in a nutshell, leadership, especially for DNP preparedness, leadership in disease prevention is very paramount and pivotal for us as nurses to be able to advocate for our diligence that are within our care. By advocating for policy changes at every level, we ensure that the healthcare systems are inclusive, patient-centered, and effective in addressing the diversified need of all the populations that we serve. Thank you and have a blessed day. Thank you.